They, however, they do not last as long as a traditional shoulder replacement. With newer plastics, getting to the patient before they've lost a lot of motion, a good functional recovery from a total shoulder replacement, and a typical total shoulder replacement now is going to last probably 15 years or more. A reverse shoulder is getting better all the time. The designs are getting better all the time, but the original designs were only lasting about 7 years because of something called scapular notching. So we didn't want to do this in anybody younger than 70. And there's a ton of people that need it that are younger than 70. So it's really pushed us to come up with better designs that don't fail as quickly. And what was failing was right here, the lower portion of this, when the patient brought their arm down to their side or adducted their arm, was notching the scapula. So it was rubbing into the scapula right here and causing notching, and that was leading to pain and failure. So we've modified the designs to improve that, and it's looking better all the time. So, and there are patients out there now with 12 years, 13 years with reverse shoulders that are doing fine. So we're getting better at it, and we're getting better at understanding it. This is an animation of a rotator cuff repair. So these are the cannulas we work through, and this is the grasper showing how that the cuff is repairable or mobile. And we roughen up the bone with a burr so that it will bleed. And then this thing passes the suture. This instrument passes the suture through the cuff. And then we take the sutures and anchor the rotator cuff back down to the bone. They've done a good job with this. So don't sleep with your arms over your head, like I do all the time. And if you lay on your side, you're not really on your side. You're on your slack, your side back. And you're pushing the shoulder out the front. So if you have any tendonitis in the front or any instability, that's going to hurt. So it should be more comfortable if you have shoulder issues. I know it's hard to sleep on your back though. So behind the neck press, it takes your rotator cuff extended and your biceps and slams it into your acromion. It's not good. Upright row, because you're shrugging at the same time, you're taking your rotator cuff into your acromion. And overhead press too, directly overhead press. If it doesn't hurt, I'm fine with it. But if it hurts, that's something I would avoid because it usually means you have a type 2 or 3 acromion in your setup. So for forward raise is fine, lateral fine, and reverse is fine. Even people get a little excited because they see the therapist doing the external and internal rotation with the band. This actually hurts if you go too far and you have any mild instability. You'll get something called internal impingement because the shoulder will roll out the front and the rotator cuff will get pinched in the socket back here. So I don't like a lot of aggressive external rotation. Bands are really good. The exercise bands, and doing those where you just step on the band, and you have 2 handles typically, and just do forward elevation right here for your deltoid. You want to get your deltoid strong. So it's like this, and then it's out to the side. So step on it or grab both handles, just like this. And then for the back, you hook it around the table or something, and just like this, reverse flap. We usually figure that out on exam and MRI. So, typical neck exam is a Sperling's test. You turn your head away from the side, tilt it back, and we push on your head. So that closes the space where the nerves come out of your neck and will cause shooting pain down that arm. that's a very positive sign that it's coming from the neck. If it were a burning pain that radiates from your neck down your arm. So if that's what you're experiencing, we get an MRI of your neck as well.
It doesn't reject it.
Metal and ceramic and these fibers are inert.
Okay, so if it's inert, no problem?
Yeah, so it's neat. You know, and then some things actually stimulate inflammation, which we want for healing. It's the first step to healing.
We get and let's take a break for 5 minutes or so, and then Dr. Ciotola will be in the back. So. It was very informative.